My name is Antonio Estrada. I work with the Erie County Department of Health. I'm in recovery. I've been in recovery for the last 26 years. This is very important to me to come out and be able to educate and promote all the different services that are for those who the last and the lost, those individuals who are struggling with substance use, and substance use leads up to a lot of the spread of some of the STIs, HIV, hepatitis C. So in our outreach events, I come out and I set up a lot of testing with our community partners and with our other co-workers to bring education and treatment to all the individuals who are out in the street today that are dealing with addiction and doing and engaging in high-risk behaviors. It's very important to educate everyone, to let them know that there's treatment out there, there's help out there, and we want to educate those who don't understand about addiction. They think it's something that people could just stop. They tell you, just stop doing it. It's not how it works. There's different pathways to recovery, and each individual, when they're ready, okay, it depends on that individual that they come forward and step into a program and get all the help that's out there for them. What I would like the public to know that addiction is a disease. It's all a matter of seeking out and finding the different treatments, that the different pathways to recovery, just like I did, and that if I could do it, they can do it.
Have you used it?
Well, a long time ago, my friend had overdosed, but we didn't have no Narcan, so I put her in cold water.
Oh, okay.
Put cold water on her, and
She came to.
yeah.
Oh, that was a blessing because you know they're not coming to today. You really need Narcan, so make sure you keep some. We're here on Wednesday.
Okay.
So you're able to.
Is this a problem?
You're able to get it from us.
Is this gonna be an issue?
Maybe
Okay.
I can come and help.
Oh, okay.
You can tell us the word. Helping us is letting this community know that we're out here
Okay.
and that we're here to help them. We're giving out harm reduction supplies. So that would be great because everybody knows everybody in their own communities. So it would be nice if you just let them know we're out here from 1 to 4.
Yeah.
Okay, appreciate it.
I'm Paula Bridgeforth. I work with the Harm Reduction Health Department of Erie County. Erie County, I am a peer navigator and I'm a lived experience person. I say that because for me, doing this work that I do, I resonate with this work. What I have seen is the drugs actually change, and what I'm seeing is an increase in older folks that are actually doing cocaine and they're overdosing. So they're going in with the intentions to do cocaine, but in reality it has fentanyl in it and they're actually overdosing. Sometimes they have Narcan, most times they don't. So what we're doing over here is we're actually educating the folks because it's happening in numbers in our data to Black and brown people. That is the highest number of overdoses, Black and brown males in Erie County. That's what I can speak on. And that's from the data. So in saying that, a lot of times they're not educated on in prevention. They're also having issues with interaction, where they feel safe. We're coming to their communities. We're actually reaching out to them where they are versus trying to get them to go into a treatment program or do an outpatient program. We're actually meeting them where they are. If they don't want treatment until they're ready for treatment, we're going to be there with them and for them. And that's what it's about at the end of the day, because I didn't want treatment. I was one who did it through Christ Jesus. So everybody takes a different path. Are you there for the whole run? That's my whole thing. So we listen to a lot of stories. Some people don't want to do treatment because of different reasons. They might feel uncomfortable in that environment. Others have stigma going on with their families or their religion or whatever the case may be. At the end of the day, If you're really trying to help folks that are using a substance that is really active in their substance use, you got to come out here and meet them where they are. You got to hear their conversation, and you got to have some compassion in your heart for them at the end of the day.
We're out doing outreach every first Thursday. We're at Group Ministries at 133 Jefferson Avenue, doing outreach and doing testing. Every second Tuesday of the month, we're at the Bell Center. Summer's coming, so we would go back and revisit that schedule and come up with another plan to have testing in that part of town. We're at 1500 Broadway on every Tuesday, and we're at Grand and Ferry every Wednesday, and we're at Riverside at 132 Vulcan Street every Friday. So that are outreach schedules, and there's at the train station, well, the NFTA in the mornings, and then in early morning outreach in the Broadway area as well.